Afternoon, everybody. We're very excited to have everyone here this afternoon or this morning, depending on what time zone you're in, to talk a little more about the Mini Nurse Academy. We have been fortunate enough to have a diverse panelist today that is going to talk about the Mini Nurse Academy. So for most of you who attended the conference in July, this might be a very exciting time because you are here probably to learn more or to hear more examples. And for those of you who are not there at the conference, this might be an aha moment for you. So we're certainly excited to have our panel. I will certainly start to have them introduce themselves, but first I just want to have a few ground rules. Just to help us get through the webinar successfully. If you're not talking, if you can mute yourself, that would be great. If you have any questions, you can put them in the chat or you can wait till the Q&A session so that we can open it up for a Q&A and I will be moderating it. My name is Angela Apia. I am very excited on behalf of our Population Health Committee to host this webinar and to be able to share this knowledge with everyone. So with that, I would like to welcome everyone again and have Dr. Coleman start us off with the process of how this will go in regards to the order of how we're going to present. And again, I'll be your moderator. So if you see me chiming in, that's the purpose. Thank you. Dr. Coleman, it's all yours.
Thank you very much. And thank you everyone for being here. I am Jennifer Coleman. I am a member of the Birmingham chapter of the National Black Nurses Association, and I am a regional coordinator for the NBNA Mini Nurse Academy, and co-chair of the committee that started several years ago getting this together. And so Dr. Lee.
Good morning, everyone. My name is Loretta Lee. I am from the Birmingham chapter. I am a lifetime member of the Birmingham chapter now, so I'm very proud to say that I am one of the co-PIs for this project, as well as a regional coordinator along with Dr. Coleman and Dr. Dawson. So I'm very excited to be here today. Thank you for joining us.
Okay. Carmen, you're muted. Let's go to Charity while she's on. Oh, go ahead. Go ahead, Carmen.
Okay, I'm sorry. I'm Carmen Isom. I'm from the Central Florida Black Nurses Association, the Orlando chapter. And I work with the Mini Nurses Academy. We're in our second cohort. I'm very glad to be here today just to give what I can and to answer questions wherever I can.
Thank you. Charity.
Morning, everyone, or afternoon. I am Charity Bean. I am a member of the NBNA of Greater STL, and I am the ambassador for the Mini Nurse Academy here in the Greater St. Louis chapter.
Okay, and Dr. Cecilia Sims.
Hello, everyone. My name is Cecilia Sims, and I too am a lifetime member of the National Black Nurses Association. I am the chair of the Birmingham Mini Nurse Academy, and I am so excited to be here.
Okay, thank you. And I guess Dr. Lee will get us started.
Thank you, Dr. Coleman. So good morning again, colleagues. My colleagues and I are extremely grateful for you allowing us an opportunity to speak to you about a program that we are so passionate about. We appreciate the opportunity to talk to you about one of NBNA's signature initiatives, the Mini Nurse Academy. The Mini Nurse Academy is a transformative program that will affect the racial, ethnic, and gender diversity of the nursing workforce, health equity, and socioeconomic status of many families for years to come. NBNA, as you know, is the official voice of about 300,000 nurses. Most of these nurses are from populations that historically have been minoritized. We know the historical background of those populations. But out of the pain that those historical minoritized populations have suffered, specifically African Americans, we have great success stories. We have Black nurses that serve across the spectrum in the nursing profession, from the C-suite to the classroom, to the research space, and to the bedside. Even though we serve across the spectrum in healthcare, the numbers of Black nurses are disproportionate compared to the majority population. This is and will continue to affect patient outcomes unless we pause and implement a strategy for change. You should know that NBNA, or the NBNA organization, and its nurses that work for the Mini Nurse Academy or that volunteer in the Mini Nurse Academy are change agents and leaders. As we talk today, I believe it will be evident why I say that NBNA Mini Nurse Academy nurses are change agents. But I mentioned also that they are leaders, because leaders or leadership is about shaping, sharing, and developing a vision and future leaders. Therefore, as members of an organization that represents the voices of so many nurses and underrepresented individuals, it is our responsibility to actively engage in efforts that will transform the quality of life for our most valuable resource, our children. This translates to better patient outcomes and health equity for all. It saddens me to say that Dr. Dawson's presidency ended this past summer, even though she has passed the torch to a great leader, Dr. Sheldon Fields, who is sustaining and elevating NBNA. But under the leadership of Dr. Dawson, we operationalized a vision of how NBNA will diversify our nursing workforce. So in 2021-2022, we convened a group of nurses from across the nation to develop the Mini Nurse Academy. We have numerous NBNA nurses who volunteer their time to implement the Mini Nurse Academy, from the West Coast to the East Coast, from the North to the South. These NBNA members are working toward two goals. One, to transform the nursing workforce through racial, ethnic, and gender diversity. And two, to change the lives of young people through education and experiential learning. Today, you will have an opportunity to hear from these NBNA members. You know the old saying that a picture or video says 1,000 words. So just to be sure we all start on the same page, first, allow me to share a video with you that captures the essence of the Mini Nurse Academy. After the video, you will hear from our colleagues. Thank you.
From the time I can remember, I've always known I was called to be a nurse. I grew up in a small town in the Alabama Black Belt, and I didn't have any experiences with nurses, particularly nurses of color. But then when I appeared in nursing school, there were not many African American nurses in my class. So after I became a nurse, I wanted to empower other African American students that even if you are the only one, you can still be successful.
I wonder if we could ask the kids what to call him.
Let's get his head on. Get the head on right.
Out of the 4.2 million nurses in the United States, only about 300 some thousand are African Americans. The National Black Nursing Association was founded in 1971 because we did not have a voice. We need to stop talking about diversifying the nursing profession, and we need to just step in, and we needed to do it. Therefore, the Mini Nurse Academy was born.
We would like to increase awareness of nursing as a career option for those groups who are not represented in nursing. We think the way to do that is to talk with students from those population areas. We're starting with third grade students, and we're putting nursing on their radar.
Hello, hello. How y'all doing today? When the kids leave here talking about what they did at school, it's awesome. So just thank you guys for providing this type of resource for our students, and this is definitely changing lives.
Thank you.
A lot of out-of-school factors come into play and affect their achievement. And to have something positive like this to come in and give them a different source of what nurses do.
You can sit anywhere you want to.
Giving them this type of opportunity will give them a better shot at what they want to do and what they want to be.
We have an exciting day for you guys today, okay? Put your thinking caps on. I hope you brought them with you, okay? The last time we met, real quickly, tell me one thing that you learned. What do we tell? Oh, CPR, very good, very good. I need 2 people.
We got Kamari over here.
So you're in the grocery store and somebody falls out. What do you do? How fast are you supposed to?
The volunteer nurses are actually nurses that are working or retired, and they follow the curriculum that we have developed. The goal is to introduce them young to the health profession, to let them know that this is something they can aspire to do. But in the process, we're also educating them about the social determinants of health.
We're gonna practice taking each other's blood pressure. So I want you to face your partner. Can you roll your sleeve up? Very good. This group of students that we have, they're very interactive and they want to learn, which is what really inspires me.
Hey, give me 5. That is so right.
For us to bring it into this community where majority of the students may not have much, it's just very rewarding. Instilling that belief, that's the key thing.
You remember? What are some factors that cause your heart rate to go up? Smoking, exercising, fevers, fevers, and age. Very good.
We wanted to be in underserved communities because let's face it, it's our underserved population that end up having to use the healthcare system the most. Why not come to this community and create the next generation of nurses that look like us and understand our lived experiences?
They're not very strong, but you know what? They can heal.
When you're in a hospital, you have to build a trust. And in the back of African Americans' mind is, are they telling me the truth? So if they have somebody that look like you, eases that individual, and they're more likely to do the care if that's advice.
Very good, very good.
So if I can make a small difference to say, you can be anybody, anything you want to be. I know you're an excellent nurse, and yes, I want you taking care of me.
We started with 7 chapters in 7 states. Our goal is a mini nurse academy in every state. We're trying to instill confidence and resilience and possibilities. So we tell them, you can be an athlete and a nurse. You can be a man and a nurse.
I like the idea of working in healthcare because, like, you can help people in need. I like helping people. Sometimes a little bit too much. Sometimes I help people even when they don't need help.
My favorite thing about helping people is that you don't need to get paid back. You can just do it for fun, and to help people, it makes you feel great.
Even if they decide not to be a nurse, I think we've planted the seed that they can do something to advance themselves. And we want to let them know that the possibilities are there.
Carmen?
Yes, go ahead. Let's hear from our Orlando chapter.
Hi, my name is Carmen Isom, and this is my second cohort. We're working with the children in the Orlando community. Just to let you know, I think that this program is the best, if not the best, one of the best programs that we could be offering all of our children. Because if you don't have your health, you don't have wealth. It's a lot of things you won't have. Your health is next in line to your soul. And what we've seen in the school system, we're working with the Ivy Lane Elementary. This is a school that was very low on the totem pole, as to say, in Orlando. And now it's one of the well-known, one of the biggest schools, because we're getting so many people calling the school wanting this program at their school. We don't have enough nurses right now. We need more nurses, more volunteers to come out. Last year we had 11 students, and we had two male students. We only had 3 nurses. We got through it. This cohort, we have 17 that signed up. We have 5 male students, and we have 2 volunteers, including one of the student nurses that has agreed, and she's giving back to the community and also to the Central Florida Black Nurses Association. And what we're seeing that the children are so excited. What they're doing, we're training them CPR. They even know the difference between a heart attack and cardiac arrest. When we teach these children this, they remember. They remember that if a person is not breathing, you do CPR. If a person is breathing, you don't do CPR. And when you got 3rd, 4th, and 5th graders learning this is an asset to the whole world, if you ask me. Because if you're in need of CPR, you're in need of healthcare, everyone, every child, every person needs to know CPR. And what we're teaching these kids, and I mean, they're grasping it. They're grasping it like eating ice cream. What we've used is the staying alive, the GB's method of chest compression. And when we put that music on, they start doing their compressions. They remember when to switch up, when to call 911, and they're just very excited about it, and they're just learning. And this year, what we did, we went ahead and introduced the pedometers, because we're talking about, getting them moving more, exercising more. And we got every child a pedometer. They take it home, they keep it a whole week. And when they come back the next week, we check the pedometers, and the one that has the most steps, they win a gift. So all of the children are moving. The steps are just going way up. Every week, the children are moving more and more. So this is something that the school nurse doesn't talk to them about. So this program is very, very much needed. I think it's needed in every school in the world, if you ask me. And we're doing hand washing, we're doing hygiene, and what we do, we show kid friendly videos, and we have a 10-step method that we use for the children when they're washing their hands. And we use the little germ light, so if they wash their hands and we check them with the light and there's more germs, they go back and rewash them. And they're learning, how to wash their hands and what things to watch out for. Be careful putting their hands in their noses, in their mouths, and they're being more conscientious. We had the kids go down to the Orange County School Board, and the Orange County School Board presented the children with certificates. When these children walked in with their lab coats and their scrubs, all of the school board and everybody in that building stood up for these children. It was awesome. They were so proud. Everybody was just asking, well, who are those? What are they doing? What are those little kids doing in jackets? What are they doing in lab coats? They're learning how to take care of themselves. They're learning how to take care of their family members, and they're learning how to take care of us. They're going to be our future. And if we don't train them now, I mean, we train them to do everything else. We train them to play ball. We train them to go to church. Why can't we train them in health to take care of themselves? I think it's very much needed. And then
Okay,
is my time up?
go ahead, go ahead.
But
Did you have one more point?
we just wanted to point out that when we did the when the children are uncooperative, are not really paying attention, we use the 3-count method, and it brings them back into focus. Into focus. Yeah.
Okay, thank you, Central Florida.
Thank you.
Birmingham.
Thank you. So in Birmingham, we have a Mini Nurse Academy committee of 27 committed volunteer nurses. We implemented what we're calling a pop-up Mini Nurse Academy at a local recreation center in the summer of 2022. We had about 15 students during the summer, so this was all new to us. So we had a lot of opportunities, but we also had more wins. Cohort 1 was implemented in the spring of 2023 at a local intermediate school, and we had about 25 students. Cohort 2, we're implementing that right now, and we have about 23 students. So we have a lab set up, okay? And just as Carmen said, we have a multi-age students from grades 3rd through 6th, and various grade levels are at each table. Our lab, we have a loaner bed and mannequin from the VA hospital. We have a wheelchair, IV pole. We have a baby mannequin and a bassinet. We have a full body skeleton. We have various posters throughout our lab, and just trying to make it user-friendly for the students. So I want to talk a little bit about the logistics of the teaching sessions. We currently meet 1 to 2 days from 1 to 2:30 p.m. And these days are set by the school. So we have no input. They give us the days to come. And the volunteer nurses are asked to arrive around 12 noon to prepare and to receive the students. Now, each session, the volunteer nurses must report to the front office with their driver's license for a background check. That's very important. Our students enter our classroom. We have their ID badges because we want them to feel like they're clocking in and out, if that makes sense. And we have roll call. Each session, we have a review, a recap, and a debrief. At the start of each class, a review or Q&A of the previous class is delivered to the students to evaluate retainment of the lessons taught previously. A brief recap of the lesson is reviewed at the end of each class, once again, to evaluate recall and retainment of the lesson taught. The program is made up of 3 modules, which are spread over 13 to 15 weeks, okay? The modules are taught, the students are given a snack, we have cleanup, they turn in their badges, and they're back to class. We recently implemented toys to teach students, the students purchasing toys to teach them how to save money. They have a bank book that is kept in the back of their ID badge. Okay, so if they don't have enough money, then they save up their money to buy that special toy that they have had their eye on. Let's see what else. After class, a debrief is held in person, or I may email the nurses, but I want to know, is there anything we can do different? Do we need to change anything? Are there opportunities for us? As far as creative teaching methods, our end goal is a presentation of a research project from these students. And they are very well equipped. They're excited about logging onto the computer. They are well diverse and knowing things about the computer. One session that I like to tell you about is our vaping and smoking session. One of the nurses was very creative. She made lungs out of balloons. And the students were very, very excited and engaged about that. We had our session where we taught about blood pressures. The first time we did it, the students broke out, okay, into different little groups. But this time we did it a different way. We had the students, we set their tables in a row, and we had one student on either side of the table. And that went very well. The students were able to reach across the table, take the student who was portraying as the patient and get their blood pressure. And so that was really, that went very well. During one of our sessions, when we first implemented our pop-up Mini Nurse Academy, we had that session we taught about famous nurses. So we wanted the students to know that we had famous nurses right here in Birmingham, Alabama. So we had our very own Dr. Lindsay Harris, who is the first Black president of the Alabama State Nurses Association. She came in and she greeted and spoke with the children. We also had a CRNA come in, my husband, to come in and speak with the students, because we wanted the students to be aware that males can be nurses too, okay? Also, during graduation, one of our volunteer nurses, she's very fluent in speaking Spanish. So she did part of the program in Spanish, and you should have seen our student who speaks Spanish and how well they received that. It was just awesome. Let me see what else. We also had media coverage from Fox 6 and Channel 13. So we're just excited to have this program and to continue to move forward with it.
Okay, thank you, Birmingham. Our team in Central Illinois had a very successful first session also, and they were able to leverage their community partners. They received lots of publicity. One of the newspapers in the area, a daily newspaper that serves 60 communities, and I think in 8 counties in the Central Illinois area, did a long article on the Central Illinois chapter and their Mini Nurse Academy. They had lots of information. They had pictures. The article had a video and everything. So they were able to garner lots of publicity. And also the district where their school is located, there are 9 school nurses in the district, and those 9 school nurses were very interested in collaborating and partnering with the Central Illinois chapter to expand the program to other schools, or for them just to learn from our chapter nurses what things they could do at their own school. So as I said, the Central Illinois chapter just were able to leverage their community partners, and that is so important for all of our groups.
So I have the pleasure of speaking to you about Midlands of South Carolina. Our colleagues in this area did a phenomenal job. If you look at the slide, you see a graduation ceremony, which is my far left. I guess it is also your far left. You see one of our lead ambassadors at the time on the right, Dr. Lori Vick. So the children actually really love, this is one of the high points of the academy, is that the kids or the children are able to wear these lab jackets that they see healthcare providers wearing when they go into the hospital. So that actually gives the students some onus of, okay, this is me, I'm a healthcare provider. In order to be successful, in order to accomplish anything, you have to first envision yourself as being that successful person, as being a successful nurse. And I think that's what this graduation ceremony depicts. If you look at the number of children graduating from this program, As you can see, one of the things we always do in order to entice people, whether they are adults or children, is to include food. So this chapter looks like they had a fantastic meal with fruits, vegetables. Looks like there's some meat on there. Looks like ham, and watermelon. So just a fantastic buffet for the kids and parents to enjoy before they finish this academy. And then lastly, they were congratulated with a cake. Who doesn't love sweets? Me in particular, but I'm more of a chocolate girl myself. But this picture of the cake that says, "Congratulations, Mini Nurse Academy graduates." How special would you feel if you were between the grades of 3 and 6 to see this? That's one of your big accomplishments that you can remember, and that will help you visualize your accomplishments when you actually walk across the stage with your BSN as a nurse, and then further your education, your master's, your DNP, or your PhD.
And let's go to the West Coast. Our friends at the Council of Black Nurses Los Angeles were actually the first group to get started last fall of 22. Their chapter started first. Their calendar was early. And to start, once they had their school held a back to school day before school started, with parents and students looking around at the school and I think at different activities and everything. So the Council of Black Nurses had a display table at back to school day at their school. They had information, of course, about NBNA and about the Council of Black Nurses. And they also had free items and giveaways for the students who came to the table. They were able to meet the parents and the students and tell them about the Mini Nurse Academy and what they plan to do to get the students engaged and wanting to be a part of it. And then once they started, they had a very, very nice time, a very great group of kids. And for that first module where we talk about, I think our Birmingham friend, Dr. Sims, was saying how they had the famous nurses come in. The Council of Black Nurses had pictures of some of our nurses from history, some of the ones that we know, and the students were able to recognize them. For instance, the Council of Black Nurses said for sure the students really were readily able to identify Harriet Tubman. So they had pictures of nurses from history in addition to our current nurses. At the end of their session last fall, at the beginning and the end, we do a pre and post survey on things about what do you know about nursing, what do you know about healthcare, things like that. And their survey at the end indicated that the students' knowledge had increased related to healthcare, what they could do to keep themselves healthy, nursing duties and things like that. And several of their students indicated that nursing was on their list as a career option. And that is our goal. So the Council of Black Nurses had a great session also.
The Central Virginia chapter, I think, is one of our most unique chapters. They implemented their project in a rural area. So we often pay most attention to urban America. In the state that I'm from, there are 67 counties, and the majority of those counties are rural. So this particular chapter, Central Virginia, who decided to go into rural America or rural Virginia, I think that was very, very innovative in itself, because it took some paying attention to how you're going to work out the logistics to get there. As you can see, this chapter is teaching their children about performing CPR, the correct way to perform CPR, having your patient on the floor on a hard surface. You also see the young girl in the middle who is doing CPR on an infant or small child. So they taught them about many of the tasks that if these students do, or let me correct that, when these students become nurses that they will be doing. CPR is one of them, a life-saving measure. I know when I was in the hospital, I love to do CPR. I don't want to say I wanted to see someone code, but if it happened, I was ready because I love to get in there and get my hands wet, get my hands dirty. And that's what these kids are doing. So when you can touch stuff, when you can feel stuff, that's how you really learn. Look at the engagement in these kids from Central Virginia.
Well, our Northern Connecticut team was ready to get going, and then there was a change in school leadership. And so that put a little bit of a pause, but our friends in Northern Connecticut are flexible, so they were able to regroup and get going. And so they had a real successful first cohort also. And I think one of the things they brought out that we wanted to share with you is they focused on the importance of teamwork and group collaboration with their students. And so one of the things they did was they did an impromptu lesson on kindness. Because as we're saying, we have a diverse group of students, diverse ages. And so sometimes the interactions were a little less than positive with them. So they had an impromptu lesson on kindness. Their students came up with, I believe they said, over 100 words that could mean kindness and how to get along with everybody. And you know, that's teamwork is so important to nurses. So I am so happy they did that. And they ended up using some of that theme as one of their research topics at the end when they got to the research module. And so a great successful group with them. You can see from the pictures, that picture in the middle with the red and blue, the red, that's actually a model of a heart and lungs, and you can kind of pump it up like you pump up a blood pressure cuff, and it makes the heart and lungs work. So they were able to see exactly how we work with our heart and lungs. Their entire program received great feedback from the students, parents, and faculty.
The Southeastern Pennsylvania Area Black Nurses Association, look at how many children that they graduated from their program. Look at the engagement of the kids when they're doing their paperwork or when they're doing their lessons. Again, as with all the chapters, the students have a graduation ceremony at the end, and that's a significant milestone for them, and it indicates that they have truly accomplished something. These kids, some of them come from backgrounds where they may not hear often, good job, or you did it. So what we've tried to do with the graduation ceremonies is to instill in these children that you can accomplish something. If you put that in kids early, that they can be successful and be whatever they want to be, they will grow up to believe that, as opposed to being told, well, maybe you just need to do X. And sometimes X is the best thing for them to do, okay? But let's give them an opportunity to explore what they would like to do. You could also look at this group and see there's diversity, racial, ethnic diversity, it looks like within this group. That's wonderful. That was also something that I think was unique about the Los Angeles chapter, is that they had a racial ethnic mix of students. And it's very obvious that one of the main things we focused on was making sure that we had various ages included in the groups. So if you look at this group, you can see that you have younger kids who represent probably the 3rd grade, all the way up to more than probably the 6th grade, as well as look at how many ambassadors, which are the National Black Nurses Association Mini Nurse Academy, the leadership of that group, the people who are really on the ground, they are the ambassadors. Look at how many of those individuals, along with faculty at the schools, are engaged.
Okay, let's hear from St. Louis now, and then we'll talk a little bit about some challenges and opportunities, and we'll open it for questions. St. Louis?
Yes, ma'am. Hi, everyone. So I'm Charity again from the BNA of Greater St. Louis. Our chapter actually was able to launch going into like the second phase of the Mini Nurse Academy because we used a community center. And the BNA of Greater St. Louis also serves the Southern Illinois area. So that includes the St. Louis metropolitan area. So the community center we used was the CAC, the Christian Activity Center, located in East St. Louis, Illinois. It was a great experience meeting with the children. Again, they were ages third through sixth grade, and we went after school because they were an after school program. So one of the best things that I would say came out of that experience and working with those students was just seeing how much that they learned and also how much they were able to teach us. Some of them, before we could even get the lesson going, if we were talking about diabetes, they're like, oh, my grandma has diabetes and she takes insulin and this is how she does it. And I'm like, okay, look at you. Like you knew more than, we expected them to. And it was just so amazing. And some of the things that they learned, one that really stuck out was a young lady whose mom was pregnant. And she said, my mom has high blood pressure. So when we did the blood pressure check, and taught them how to do so, she was saying how she witnesses her mom taking her blood pressure. And when we tied in nutrition into that, she said she went home. And so now, like when her mom's eating and she's around her, he's like, no, mom, you can't have that. That's not good for you and the baby. She's like, that's going to raise your blood pressure, And so just listening to them not only engage with us and tell us what they knew, seeing the excitement in their eyes, and some of them really latched on to us, were excited to be with us and see us coming. Just knowing them, they came back and couldn't wait to come tell us what they went home to teach their parents or their family members. Now, one grandma was a little mad. She said, don't tell me what to eat to the kids, but it turned out great. So to see them so young have such an impact, starting again, it starts at home. So starting with their families and being able to branch out in the community and express what they learned. And I'm looking forward to our next cohort in the Legacy Center in St. Louis.
Okay, thank you. So we've just had a little snapshot from some of our chapters to see what they're doing. And on the screen here, you see some challenges and opportunities that we have, and I guess lessons learned that we have available to us. And I believe our speakers have talked about most of these: the student civility, our friends that did the kindness module, the rearranging of the seats and the chairs to keep the students engaged, those kinds of things, and just modeling correct behaviors. Our nurses who are there have been doing that. The complexity and volume of module content. And I think a couple of our presenters spoke about how they did innovative teaching strategies on the kids' age. The kids made loans, they did these things. So to make the content kid-friendly, but still we used proper terminology and everything and taught them that. Recognition of accomplishments. We talked about that with our graduation ceremony. The good job you saw on some of the things, the video, high five, good job, you did great, telling them they were doing great. The academy teachers' readiness for teaching, because some of us, our nurses are not teachers, and you're thinking, and even if you're a teacher, you're thinking teaching a third grader. So you heard how some chapters, the students, for instance, the one chapter, the team of Mini Nurse Academy nurses met before they went to the school several times, like weeks, and talked about the modules and talked about how they would present them. And they actually would practice presenting to each other. So somebody could say, oh yeah, that's great for a little kid. So that's how we did that with the teachers. Parent engagement, sending things home to the parents. When the kids take things home, if they take a brochure home or something, sending it to the parents. And like our friends from St. Louis said, the kids are telling the parents what they're doing, keeping them engaged. And then the parents are invited to the end of the program graduation ceremony. And the Birmingham group, a lot of the parents were Spanish speaking. And so they had a Spanish speaking nurse there to make sure the parents could know what we were talking about and everything. Let's see, some technology, internet concerns, because when we get to the research module, the students need to look up things. So some chapters use their own personal hotspots. Some schools have a guest account that you can use. So those kinds of things were needed. We had a few delays with equipment delivery coming out of the pandemic was part of that. You know, supplies were delayed. Then the holidays were in there. And our teams were able to be flexible. You know, nurses are always flexible and work around that and get the supplies and things that they needed. So they did a really good job. So right now, some of our teams have started their next cohort of students. And the intent of the program is to be at the same school. And so they've started new cohorts of students at the original school. Some of the previous students who have graduated have come back as a guest at the new students to say, you know, hey, I finished, I'm glad you're here, that kind of thing, kind of as a helper, but as a guest. We're expanding into additional states. And any chapter that is interested in joining can contact the regional coordinators. That will be me or Dr. Lee for more information on how to start. You probably want to speak with the leadership of your chapter first and start convening your chapter team members who are able to participate and lead the Mini Nurse Academy. Because if you noticed on the video and in some of the pictures, each session, there were several nurses just kind of hanging out, you know, because one of the goals of the Mini Nurse Academy, yes, we're doing educational things, but our goal is to be a role model for the students. So we're not only just teaching them, we're modeling those behaviors and again, instilling in them the notion that they can advance themselves. So select your team members and make sure you have a dedicated team who can be at the sessions most of the time. Investigate any funding. Our original cohort, our first pilot group, we had a great grant from Direct Relief. We've exhausted those funds. So any chapters that are able to secure funding for supplies or anything that will be needed, that will be a great thing. And then finally, this is a longitudinal study we're doing, a process. So we're not just teaching them and that's it, and this is great. We want to stay in touch with our students. So our plan for staying in touch is to contact their new school, especially our sixth graders, sixth graders, they moved on maybe to another school. Contact their new school, offer to come to career day, anything like that, to stay in touch with our students and be that role model. Invite your students to enrichment activities in the community that the chapters are doing. We've had students from the Mini Nurse Academy come in the community with their parents to health fairs that the chapter's doing. We had several students from the Birmingham chapter attend the NBNA conference this past summer. They attended the opening ceremony and they attended the Youth Institute. So depending on where the conference is, if it's close enough to your chapter, have your students come. And the Youth Institute is always great. I think that's all we have. Well, the last thing I think Dr. Sims mentioned the Pop-Up Academy. Dr. Dawson coined that phrase for those academies that may not be in a school continuously, but they're interested. So the Pop-Up Academy summer of 22 in the Birmingham chapter was at a rec center. They met all of the other requirements with kids from underrepresented areas and things like that, but they just were not housed in a school. So that's what we're terming a pop-up academy. It can be a church camp. The Oregon chapter did a church the summer of 22 because they had a summer camp for kids that would meet the requirements. So that is all we have, and we are happy to take questions.
Thank you so much. Before we start taking the questions, just wanted to make sure we address a few that was in the chat. It might answer some of the questions that would be raised. Some of the challenges were addressed in the challenge PowerPoint, so thank you for that. There was a question in the chat about transitioning to middle schools and high schools and what are plans for that, especially since it's a longitudinal study.
So that's where we say we know typically at that graduation ceremony, we're able to gather contact information from parents. And so we know where the student is going to school. And most schools have career days and things like that. So we can reach out to the parents on a regular basis to see how their student is doing. And then at that middle school or where the students are, we can also ask that middle school if we can come one day for the entire group to career day for the entire school, for career day or whatever they're having, in order to stay in touch with the student that we know from our original Mini Nurse Academy, and also to reach other students in the area. So that's the plan.
Hey, thank you. And the next one is, were you able to obtain MOUs with the school? How did you manage to do this in the schools? Did you have an MOU? What was the process?
Okay, Dr. Lee, do you want to take that?
Sure. So to try and cut it short, I see we do have quite a few questions, but we did develop a MOU, the Mini Nurse Academy leadership, along with input from our members. We developed an MOU, our standard MOU, and we provided that MOU for the school's leadership, asked the principal or whoever their designated person was to sign the MOU. So for the most part, there was no problem establishing an MOU with most schools.
Okay, the next question is, it's actually, I'm going to bulk two in one. It's about continuation of students and who have done it in the past. And if chapters are obtaining for funds, what does that look like? And with that too, there was the same question raised in regards to students returning as guests to help out.
Dr. Sims, do you want to tell how you all are handling that?
Yeah, so for students that have graduated from our program, I reached out to the principal to see if those students could come back and attend one of our sessions just to bring back a nugget or encouragement, tell the now students what they learned and a little bit about our program, and it has been received very, very well. Now, we did have one of the students that wanted to actually come back through our program. Unfortunately, we cannot allow that because the program is set. And once you graduate, you've been through all three of the modules. So, yes.
Okay, thank you. Outside funding, I think you've already addressed it a little bit in regards to the chapters are okay to seek funding. This question is more about existing chapters. Have they opted to obtain their own funding, meaning those on the call? Since the fund is running out, how are you going to maintain your fundings?
So for the existing chapters, the original funding was for supplies, those big supplies that you saw, the mannequins, the skeleton, things like that. And so that is one of the reasons why we're at the same school, because those supplies are still there. And so we're using the same supplies. Other things that would be needed would be prizes, little prizes for the students, snacks and things like that, that the chapters have been able to fund so far. But the bulk of the larger things, the lab coats, the big supplies like that, came from our original funds.
Okay, thank you. You did mention this is a longitudinal study, so you probably already, but one of the questions just wanted to know, how long would you follow the students? So I'm guessing, for example, after they've graduated, would you continue to see what they're doing? Did they go into healthcare, so on and so forth?
Our goal is to follow them through high school graduation and to find out at that point are they planning to go to college, and what are they thinking might be their career choice? So through high school graduation.
Okay, thank you. And you mentioned rewards. Some of the things that is being mentioned here, you had a diverse ways of recognizing them. Was this part, can this be counted as a community service for them for students who are in school, since sometimes this is something that is asked of them?
So that actually depends on the school. They make the decision. The elementary school, they make the decision as to what can be counted as community service. But we did have some students at some chapters who came out to help. So if their school approved it to be counted as a community service, then it was certainly okay with us. All of the students, though, were accompanied by a school personnel or a parent, but they're certainly welcome to count these activities as community service if it's okay with the school, or if they're trying to count it for some sort of other activity, they're welcome to do that as well.
Okay. And I think going with that, did you compile any teaching strategies or activities that can be shared with other chapters who would like to participate?
So I think that's an excellent idea as far as writing down, documenting a list of strategies. We have not done that as of yet. So what I've done for new chapters or new chapters that are implementing is I partnered the new chapter with an established chapter. So for example, Birmingham and a chapter in Louisiana who's planning to start, I suggested or asked rather, Dr. Sims if she would be willing to give suggestions to a Louisiana chapter as to how they can get started. But that's an excellent idea as to, that we do need to create something that we could call best practices as to how to implement. However, what works well in one school system may not work as well in another, but that's an excellent idea.
Definitely. And I think it kind of goes with the whole concept of evidence-based practice, and you can take those and run with it so you don't have to reinvent the wheel. Another question is, did you involve the parents or the caregivers in the sessions?
We did not well, as far as I know, we did not have parents there because it was it's during school. Most of them are during school time. Parents are certainly welcome to attend though. And we have a letter to parents that the National Committee created that tells the parents they are welcome to attend any sessions at any time. They were certainly at the graduation ceremony, and then they bring them to the community events. I think most of the sessions though is it's hard for parents to make it to those, but they know they're invited. And as I said, they all get a letter saying you're welcome to attend.
Perfect. Thank you so much for that insight. I think a question that has been asked during the conference and now is a toolkit. And I think that it's definitely a best practice. And as we've both heard, this is an ongoing great, excellent things that we can continue to do in our communities. You did mention there will be a process of sharing that information during the conference. Is that still the plan, or is it now live? So this is in regards to a toolkit.
I think that's a great idea that we can plan to do. Yeah. I had not thought of it, but that would be a great conference session.
Definitely. I agree 100%. And I know you've already answered this, so if I would skip it, I think with studies, what come with it is publications. So I think that the question was, are you going to have a manuscript? And obviously with this such a wonderful outcome, I believe obviously that would be the plan. Anything else you want to add to the manuscript perspective?
Most definitely. We have discussed the manuscript. Dr. Coleman prepared an excellent outline. We've not moved forward with that as of yet because we had some other housekeeping details, but we are planning to disseminate the information. We do have enough data that we can disseminate a great manuscript so that hopefully our program can be replicated, even though we want credit for the program. But if you create a great program and you disseminate the information, it's going to probably be replicated. So that's the purpose of us jumping in there early, getting our program copyrighted and whatnot, and then we're going to disseminate it out there in space so other professional organizations can replicate it if they like.
Definitely, because the next question on here is talking about that exact concern. So you probably read the person's mind. It's talking about sharing it on the share drive, but I understand what you're saying in regards to having the evidence, publishing it, and the copyrights. I think another great question that can conclude all of it is, where do we go from here? So the studies have been done. We have great exemplars. And we know NBNA is supporting this with great things. I do know the concern about funding is always a concern. And we will continue to support this by holding as much webinars as we can to make sure all our members and chapters are aware. Is there any innovative ways? I love the pop-up idea. I think it's an excellent idea, and I think chapters should take advantage of this. Would you be taking this on the run? We be seeing you on like TV shows to really take this to the next level in regards to, or are we waiting for the manuscript to come out? I think that would kind of conclude all the questions and the next steps.
I think that's a great idea to take it on the road, and quite a few television networks have a health moment or what's happening in our community moment. So I think that would be a great idea.
I definitely don't know where the funding will come from, but I think it's a great, we can all chip in and try to see how we can fund it. One of the innovative ways we can also do is doing giving months, which is in November. We can also maybe talk to our current president and do a fundraiser to support the program. So I believe it has a lot of potential, and I think the chapters, we can all help in regards to how we can help fund this, such as using Giving Tuesdays, fundraisers, and things like that to be part of it. I feel like we don't need to have just a scholarship section anymore, but the next generation is exactly what you're doing. So we might have to start putting $5 away and doing the NBNA conference, calling people to donate, because I think it will go a long way in investing in our future. Well, I do want to thank all of you. This has been very, very rewarding and such a follow-up from the conference. We will be sending evaluation. So if you want to see more of this and you want to do a chapter specific, the contact information is on here. Please feel free to reach out to be able to do it in your chapter. Let's keep the conversations going because this is very much a best practice. And I think that as diverse African Americans, Blacks, and nurses, we know how this is. So however we can support this will be great. So thank you all. Any last minute from Dr. Coleman, please?
No, just thank you for having us. And again, our ultimate goal is to diversify the nursing workforce. So we are interested in putting a mini nurse academy all over the country. So chapters that are interested, please contact us. Our goal is diversity in nursing.
Definitely. And I also think a last idea, if the chapters are up to it, maybe you can have champions and liaisons that can also help keep this going on the road. With that said, I do want to thank all of you again for joining us. This has been very productive. From my records, we have over 80 people joined between now and then. So I will consider that a very huge successful webinar. And we will continue to bring you these as our members. And thank you for your engagement and have a wonderful afternoon.
Thank you. Bye-bye.
Bye-bye.